Well, hello, folks. It is about 3 p.m. on April 13th, 2020, Monday. Vlogging from my afternoon on my one day off here per week and taking some mental break and did a little bit of light reading and just trying to take it easy. It was kind of severe storms today, so there was no reason to go outside. Hopefully, wash some of that COVID-19 away. So, I'm a concerned doctor, and today's fact will be on influenza, and the topic will be what are the differences between influenza and coronavirus? A lot of people have stated, their impressions that, the flu is much worse than corona. I can tell you personally from working on the front lines and seeing, both young, old, different nationalities and races come in and sort of nobody immune philosophy that I've, never seen anything like it, and I'm sure many other and most healthcare providers would agree. But one fact is that influenza does have four types actually, A, B, C, and D, but only three of those four types can infect humans. That's A, B, and C. D is never been found to infect humans, although is thought to maybe have the potential. As far as numbers go, there's about 3 to 4 million world cases of influenza, one of the subtypes, and about 290,000 all the way up to 650,000 deaths have been reported internationally, worldwide, for mortality. Young and old are the ones most at risk, where that is kind of a difference because with corona, thank goodness, we're not seeing the pediatric population come in with this. There have been a few reported cases and even mortality in infant, but overall, the young seem to be protected, and hopefully with time we'll be able to figure that out. But the old are certainly at risk in both conditions, influenza and coronavirus. And of course, if you have comorbid conditions, both of those viruses, you'd have an increased risk. Flu has been around for a while, right? And in 1918, there was a pandemic, the H1N1. It was ultimately found to be the cause of that pandemic. And so I did review an article online from Healthlines. It kind of went through some of these differences as well, and I'd like to go through that. The flu season, thank God, is almost over. It'll end in the end part of May, so we're almost there. But we've seen a tremendous slowdown in the cases. Obviously, starting in October-ish is when the flu season starts. I know I got my flu vaccine actually after that, but it was required to be in the hospital. So the flu season runs from October to May. With corona, we know that the first case was at least reported in China in the end of the year, end of 2019, December, and the first case was in Washington State in mid-January. We suspect that it may have been around many weeks, if not longer, prior to that. So we don't know what the true coronavirus season is. It will be defined after we see the numbers decline and disappear, hopefully very soon. If you look at deaths, just until mid-March, the CDC had reported about anywhere between 29 and 59,000 deaths for influenza. So we're starting to approach that lower limit of the 29,000, but it can go all the way up to 60,000 for influenza. We're reaching, again, the just over 20,000 with corona so far. There are no FDA-approved treatments for coronavirus. Of course, we know that it's sort of the Wild West right now, and the treatments are just being thrown at people. Hydroxychloroquine, the IL-6, anti-IL-6 medications, as we've discussed, and other antivirals and plasma therapy coming to the front. But none of this is FDA-approved. And of course, with influenza, we have FDA-approved treatment, both pills for once you're diagnosed or even prophylaxis if you're exposed, and of course vaccines exist. And we know that with COVID-19 that there's currently 70 companies or so working on vaccines, and there's literally hundreds of studies that are undergoing, whether it be recruiting now on clinicaltrials.gov or at institutions or university settings. With flu, it's been around, so there's immunity, even though it's rapidly mutating the flu, and that's why you have to get an annual vaccine if you take it. Even though the vaccines were dismally low in percentage of efficacy this year and many years. In fact, they were just around the 20% mark is what I heard earlier. We saw mostly influenza A this year. It started off with a little bit of B, but then converted over to A, and that's not atypical. I remember a couple seasons back we were seeing both A and B almost equally. But it does mutate and change fast, and we know that coronavirus is mutating and is changing fast as well. But we don't know and have a grip on once a vaccine is out, how frequently you're going to require that. Is it going to be annual? The prediction is probably yes. The flu deaths right now are still way under 1%. Again, with treatments and vaccines, just a fraction of a percent. If you look at the death rates around the world today for coronavirus, there's a total of 1.87 million cases reported and just over 116,000 deaths as of a couple hours ago. In the United States, over 560,000 total cases reported today and 22,861 deaths. So the percentage of death or the mortality rate is well over 1%, and in some countries it's reaching 2, 3, 4, even 5 and 6% we've seen, as in Italy when they were at their worst. Again, remembering that this is a new virus, so we have little experience with it, although they have been working on other coronaviruses, and we know there's several strains that are less deadly. Again, the flu's been around at least since the early 20th century. Both have respiratory symptoms, so they are respiratory droplet spread. They can be very similar, although the incubation times are quite different in the sense that COVID virus can extend from 2 days all the way up to 2 weeks or 14 days, and we know that there's likely asymptomatic carriers that have the infection or they're carrying it, and that they may not exhibit the symptoms yet, or they have just very mild symptoms, and they can transmit the virus. That's now known. The flu, it sort of comes on quick and it's fast and furious. If you get treatment, then it can be curtailed, but it's about a 1 to 4 day incubation with the flu. So a significantly longer, potentially longer incubation period, up to 2 weeks with corona. Again, with flu, it usually comes on very fast. It's rapid. You do get fever, cough, fatigue with it. Usually shortness of breath occurs in flu when you have somebody with a comorbid condition. So if they have COPD or asthma or some other pulmonary or respiratory cardiac disease that already has shortness of breath associated with it, chronic heart failure, etc., then they may get some increased shortness of breath. But with coronavirus, it sort of sneaks up. It's a sneaky virus. They may have very mild symptoms that dissipate, and then in that second week, it can be a BAM effect where they really get hit hard. They can become hypoxic and not even know it. We're seeing this a lot clinically, and that differs from the flu. Fevers can be really profound in coronavirus. I had a young 20-year-old I saw the other day, and he had over a 104 fever. We're seeing that even older population. I think the younger 20-year-olds can handle it a bit better. He didn't seem to flare up as much as the infiltrates on imaging, like we're seeing in those who are 40, 50, 60 plus. But cough is very common. Not all of it is productive. Some report productive cough with corona. A lot of it's just this dry or difficulty clearing. They're very weak. Seems to affect the musculature. They get fatigued, and they do seem to get short of breath when they're getting that more moderate to severe case, the ones you have to really worry about as far as when they can crash sort of that second week, that 8, 9, 10, 12 day mark, where they can kind of go down and require higher oxygen. It's very unpredictable. As far as the less common symptoms with flu, they can get nausea, diarrhea. I think personally I've seen that more with the flu B cases, although it is less common, but some will report that. With corona, they can get some of the other more common flu symptoms, such as body aches and pains, but it's less common with corona. Headache, runny nose, stuffy nose is more common in influenza, less common in corona. Sore throat, same thing, and nausea, diarrhea, we are seeing with a good amount of the corona patients, but it's still considered a less common symptom. But if you get that runny nose, stuffy nose, you're more likely to have flu or allergies than you are to have corona. Severity in corona ranges again from asymptomatic carrier to asymptomatic mildly infected, if you will, not even knowing it, sort of just a mild malaise, all the way up to acute respiratory distress syndrome and multi-organ system failure. 1 in 5 patients who are diagnosed with corona will end up hospitalized. So that's 20%. They can end, what happens is that when the symptoms start to increase in that week 2, again, that 8-day, sort of to 10, 12, even 14-day mark, where it can incubate during. With flu, we sort of, I don't want to say got it down to a science, but much more prepared, understand it a lot better, usually more mild. Again, you can get influenza if you've been vaccinated. It was a very poor success rate this year, at least the numbers I saw, but they tend to get milder disorder, and they usually have more mild symptoms. Some do get hospitalized, especially again if they have comorbid conditions. As far as contagiousness goes, with corona, it is thought to be more contagious when you have the symptoms, although we're still trying to figure that out. Whether or not these patients are recovering, and we're hearing stories of patients who have been tested for corona. This is over a month ago, and have wanted to give plasma and then end up testing positive still, 4 or 5, even 6 weeks later being anecdotally reported. Again, they can spread it asymptomatically. And then usually with flu, about 1 day before the symptoms start, that risk of transmission occurs, and about 3 to 5 days after those symptoms, they can hold on to it. They can incubate. So in conclusion, the flu is old and the corona is new. The flu is predictable and the coronavirus is very sneaky and unpredictable. The flu has approved, FDA studied, randomized, hundreds of studies out there on influenza, many studies on treatments and these products that already exist. There are vaccines. It definitely mitigates the severity. Corona is got no FDA approved products. It's the Wild West, as I said. We're throwing things at patients, trying our best to get them better. Some things seem to be working. Mixed things are coming out about hydroxychloroquine and azithromycin, the heart block issue and increased cardiac death. It may end up being more of a prophylaxis product, or and who knows, it may just end up not being the product of choice. Time will tell. The flu shut down the world in 1918, and the coronavirus started shutting down this world in 2019 and continues to shut it down. A lot of politics right now on when to open up, the government and open up society again more fully. They're trying to predict this because numbers are trending down. My personal opinion is there's no way you can predict this. And until we really understand how those numbers are trending over several weeks or even months, it's going to be impossible to make that determination, at least safely. Good news is humans are tough, we're resilient, we're smart, and we will persevere. It's just a matter of time and figuring it out. Everybody have a great night and stay well.